And don't these next two guests know it and fear it and feel it? With us now are Deborah Cavallaro and Richard Helgren, two of the many Americans who are coming to find they cannot keep their plans after all. Deborah, give me an update on what you experienced.
Well, it's basically the same thing we've been hearing from a lot of people, which is I received a letter dated September 27th from my insurance company, Anthem Blue Cross, telling me that my policy was no longer going to be available because it did not meet the requirements of the Affordable Care Act, and that I would have to make a decision by December 15th, and they had a plan for me that was similar to what I have, that they could switch me into, but that plan would cost me 65% more per month than I am currently paying. And they could not tell me if my doctors would be covered, my doctors or my drug formulary. In fact, they said in the letter that they would be making changes to the doctor-physician network and the drug formulary, and they could not say whether mine would be covered.
Amazing. Richard, what about you?
My situation was real similar. I received a letter last Wednesday, the 23rd of October. The letter was actually dated simply October of 2013, so that was a little bit deceptive from the start. The letter told me that I would have 17 days to decide whether to accept terms of a new policy that was going to be offered, because the plan that we've had my wife on for the last several years was no longer going to be available because of the changes under the Affordable Care Act.
Who was telling you that, Richard?
Physicians Health Plan, my insurance company.
Gotcha.
Here in Michigan. And what they did, a little different approach than what your other guest experienced. My premium was only going to go up about $6 a month, from $459 a month up to about $465 a month. But what they did there, our old policy had a deductible of $0, and they were going to increase that to $2,500 a month. We had a co-insurance requirement under the old policy of only 20%, whereby we'd pay 20 cents of each dollar of medical expenses after deductibles would be in play. That changed to 50%, and my out-of-pocket costs went from $3,000 a year up to $8,850 a year. So they provide us with much less insurance for just slightly less money. So the terms were very, very poor in my estimation.
The argument you hear from those who support the healthcare law, guys, and Deborah, I'll address this to you, is that you guys are more the exceptions than the rule, that most will do better under this plan, not worse, not pay more. When you hear that, Deborah, what do you think?
I think that does not apply to people who are self-employed and are having to buy their insurance independently. I think that may be the case for people who have company insurance or are on big group policies, but certainly not for those of us who are taking care of ourselves.
Gotcha.
And have to purchase our own insurance.
Well, that's a large chunk of Americans. Richard, it's about 18% of the public out there that has to fend for itself or themselves, like you guys. So that begs the question, if you're getting sticker shock or certainly premium shock, I would imagine many are. Do you feel hosed here? Do you feel that promises made were promises broken? What?
I feel absolutely hosed by the Affordable Care Act, and I think that the people that are experiencing the pain are those that had decent, relatively affordable health care insurance available in their respective states. Michigan, we had some decent options available to us here in my state. That might not be the same situation in, say, New York, where I know that individual policies were exorbitantly expensive before the Affordable Care Act. And that's why I think that these examples the administration keeps throwing out are that policies are more affordable in New York. Well, that's a pretty low bar for the Affordable Care Act to get over, in my estimation.
No, it is a pretty pricey area. Real quickly, I mean, when you hear now the president's top lieutenant saying, well, yeah, or Steny Hoyer saying, yeah, we knew that some would lose their insurance. Some others saying, yeah, we knew that some would pay more for their insurance. How do you feel about that, Deborah?
I think that's just outrageous. I mean, honestly, it is shocking to hear that. And the effect that it has is something that you've already mentioned, which is it erodes the trust of the American people in our government, in our president, in the Congress. You really believe now that you cannot believe anything that you hear from them, because they're just not telling the truth. And once that trust is lost, it is very hard to regain.
You feel the same way, Richard?
Absolutely feel the same way. And if I had a subsidy provided to pay for my premiums like our congressional leaders have, I wouldn't really care too much about this either. But nobody's subsidizing my premium, and I have to go out there and fend for myself. And I feel like the whole system is being changed and the rug's being pulled right out from underneath me.
Guys, we feel for you. We do want to look at your cases, though, as what they call the unintended consequences of big government. You both illustrated, sadly. Guys, good luck.
Thank you.
Thank you.
Meanwhile, it's not